Welcome back to DermDocs, everyone. Today we have the pleasure of speaking with board-certified dermatologist and dermatologic surgeon, Dr. Michael Gold. Dr. Gold was just named one of the top 3 dermatologists in Nashville. He's also earned worldwide recognition for providing patients with leading-edge technological advances in dermatology. Dr. Gold has authored over 300 published scientific articles, 35 textbook chapters, and has edited 2 textbooks on photodynamic therapy. He serves on most major dermatology journal boards and is the current editor-in-chief of the Journal of Cosmetic Dermatology. Hi, Dr. Gold. It's such a pleasure to have you on the podcast today. Welcome.
Thanks for having me.
Of course. So you are regularly named on top doctors lists and were recently named one of the 3 best dermatologists in Nashville. What's your philosophy for maintaining a robust clientele and high patient satisfaction? And can attendees at South Beach Symposium expect to learn ways to improve their business practices in addition to cutting-edge clinical techniques?
Oh, sure. So, why am I a top doc? I have no idea, but it's hard work, and I'm old. So, I have been around Nashville for 30 plus years, and have been very fortunate in my practice of medicine, my practice of dermatology, to be part of a bunch of cutting edge technologies in the cosmetic world, but also in the med derm world. And so I think that you get to where you are because of, hopefully being good at what you do, hopefully being respectful to your patients and clients and staff and all that, and then being a hard worker and not saying, oh well, I'm going to work 2 hours a day, 2 days a week. This is a full-time job, and I spend hours in my day taking care of patients, taking care of meetings, taking care of other obligations related to my practice. I have a very large clinical research site, and seeing patients in that setting as well. So, and then I publish a lot and speak a lot. So it's a combination of lots of things, lots of good fortune, lots of being in the right place at the right time. And, I think that when you come to a meeting like South Beach, which is, a well-respected meeting in our meeting space world, you learn from people who have set the bar high, and you learn not only how to do things correctly, what are the newest techniques and treatments out there across the spectrum of dermatology and aesthetics, but you also learn how to deal with the business aspects of what we do. And the other part of that is that the faculty at South Beach is amenable to talking to people. So sometimes we go to meetings and, the faculty gives a talk and then they disappear. You'll find the faculty at South Beach are always around, and we make sure that we interact with the docs that are there, the practitioners that are there, the industry that are there. So it becomes very congenial at the same time.
Wow, great, wonderful answer. And you're very clearly great at what you do. So thank you for that. You are world renowned for your expertise in energy-based devices to treat a myriad of skin conditions. Can you tell us about the success you've seen specifically using EBDs in patients with skin of color?
Sure. So again, I have been very lucky, again, doing things that with devices, energy-based devices that, for almost 30 years now. So I work with most every company that's in this space at some point in my career, helping either with an FDA approval or a concept to figure out how to make a machine work better, those kind of things. So one of the things that I learned early in my career was that skin types are really important when you deal with energy-based devices. And obviously the darker skin types, the Fitzpatrick's 4, 5, and 6, are the most difficult to treat. Not that they're hard to treat, but there's some inherent adverse events that can happen if you're not careful. And with all my companies that I do research for and work with, part of what I always tell people when I lecture is the United States is obviously the market, right? Every company wants to be part of the US market, because we're sort of the biggest market sales-wise for companies. The reality is the Asian market is the biggest market, and skin of color in general, comprises, it's like 40-50% in the US now, but it's like 80% outside the US. So if a device is developed and it doesn't work in Asia, and Asian skin types can be light Asian to dark Asian, they're not going to sell. So the burden sort of came to me at the beginning and continues now to be able to figure out how to use these devices in Asia. We also obviously have a very large African-American population that wants devices and wants these treatments. So we have to learn how to use them correctly for that skin type as well. So a lot of our efforts over the last 5 or so years has been designed to safely and effectively treat skin of color, and we do it well now. It's not something that you can just turn on a machine and go point and shoot and you're going to get every patient to respond. You really need to understand how these devices, no matter what kind, work, whether they're even something you should use in darker skin types, and how to set the machines accordingly and the patient expectations for whatever you're treating. So there's a lot more that goes into it than just turn it on and shoot. And hopefully over the last several years, 20 years, I've been able to show people how to do that pretty well.
Well, that's amazing, and we appreciate your expertise. Can you please tell us a little bit about the sessions that you'll be presenting at this year's South Beach Symposium? Are there similarities in treating?
Yeah, I don't even know all the sessions I'm presenting yet.
Oh, wow. Well,
no, I'm
sure you have several.
Yeah, I have many. So at South
Yes.
Beach this year, obviously I am in charge of what I call the live laser demo, where we work with showing live while we lecture on different devices. So and again, it's a myriad of different devices, and sometimes in an hour or an hour and a half that we have, we'll cover 10 or 15 devices where we'll actually do treatments. We'll actually explain the treatments, show the device settings, and at the same time on a different screen, we'll go through what the machine does, the before and afters, and so forth. And it's rapid fire, and it's really a lot of fun, and I've enjoyed doing it for many years at South Beach. I'll also then speak on various other topics at the meeting, including microneedling, which has become very popular in today's world. There are great needling devices out there. We'll go through some of the evidence-based medicine to why they're useful and where they're useful and how to use them.
So why are they useful?
Because microneedling, one thing that's a nice part of there are pens for microneedling, and then there's radio frequency microneedling, and the difference is that we can get a little more powerful with the RF microneedling, radio frequency microneedling, but needling itself is colorblind. So the needles, even radio frequency, does not care what skin type you are, and that's important. So again, we can treat skin of color. We can treat acne scars, traumatic scars, lift and tighten the skin. There's a lot we can do with needling, and it's become very popular. Again, you have to know how to do it, and you need to learn the tricks of it, but it can be very successful if you do that. So I'll talk on that. I'll talk on skincare. I'll talk on some other things. And one of the panels I enjoy the most at the meeting is I share a panel with Dr. David Goldberg, and we cover complications from fillers, toxins, energy-based devices. And again, it's showing people that things can go wrong and how we fix them. So that's a great session for me. I always enjoy doing that as well.
Okay, and speaking of energy-based devices, are there similarities in treating acne and rosacea with those?
Treating acne and rosacea with devices has become more complex recently. So obviously, you can use um, any type of energy-based device that covers vascular stuff like hemoglobin. Um, and so that helps make the acne lesions get better. It can make some of the scarring get better. And for rosacea, it can make the flushing, the redness get better. So we have a bunch of devices that exist for acne scars, rosacea. Now in today's world, we actually have some newer devices targeting the acne sebaceous glands, which are new, and we're gonna learn more about the efficacy of it and the safety of it. But right now, it seems to be something exciting and useful. So we'll see how that plays out too.
Okay, thank you. So are lasers for hair loss the future of alopecia treatment? And briefly, how do they work? What is the course of treatment, and how can providers predict and determine which patients will see the improvements?
So lasers to treat hair loss. It's sort of a weird thing to talk about. So we've talked about lasers to remove hair for years, right? And so we have great devices for hair removal. Hair treatments to grow hair has been a concept for a long time. So we have low level energy red light lasers that you can put on your head and wear at home or do in the office settings. They've been around for a while, and we know they work. There are lasers that are a specific wavelength that we know can give us. We can do fractional laser treatments on the scalp and add some actives to help promote hair growth. And those have become very popular, and I'm sure they're all going to be covered. And then, we have robots now for hair loss treatment. So if somebody needs a hair transplant, we now have robotic technology for that. And so we use all those in our practices. And we can treat just about anybody with hair loss now.
That's wonderful. So is this treatment specifically for alopecia related hair loss, or does it translate to male pattern and age related hair loss and thinning as well?
So when we're treating hair loss, it's usually what we call androgenetic or genetic hair loss. So male pattern hair loss, female pattern hair loss. That's what these devices are most useful for.
Okay. So you're on the cutting edge of new approaches in scar treatment. Is this area where medical and cosmetic dermatology collide?
Yeah. Treating scars is a passion of mine. I introduced silicone gel into dermatology almost 30 years ago. So I've been looking at scars from different angles for many years. And again, we can medically treat, cosmetically treat, whatever it is. Scars are scars. Some are disfiguring. So we have a lot of treatments for scars, including the energy-based devices. So whether somebody has a raised red scar or something like that, we can use our vascular lasers, our carbon dioxide fractional lasers. If somebody has a really bad keloid, we have superficial radiation therapy. We're taking people that have issues and problems and making them better, but yet there's always a cosmetic side of this, because if the end result is worse than where we started, that's not good. So cosmetically, we're always thinking on those lines.
Okay. Would you say there are challenges to achieving optimal results, and maybe that some providers should be aware of?
Treating scars is always a challenge, all
Mhm.
right? And if you don't know the pathophysiology of what a scar is, and you just treat a scar, you're going to end up in problems. So you cut out a keloid, it'll grow back, and it'll grow back bigger and more itchy or more painful. So you need to know what to do if you do those kind of things. So that's where the superficial radiation comes in very handy, along with other things we do in the office. If you do any kind of energy-based device, again, you have to know that the follow-up and the care of the patient at home are crucial to making their scars stay better, and getting resolved. So yeah, there's a lot of nuances that go into treating scars. And again, we spend a lot of time with our scar patients, just making sure they understand all these little subtle things that we do.
Wow, yeah, so definitely not simplistic by any means.
No.
Is there anything else you'd like to share with our audience today, Dr. Gold?
No, I think you've covered a lot of things. I think South Beach is a great meeting. I think we're going to have a wonderful opportunity to learn and share information with everybody. So I just encourage people to come to South Beach in August, and let's have a good time, but let's have a learning experience that is great.
Awesome. Thank you. And we can't wait to see everyone there, and we can't wait to see you. So thank you so much for your time and your knowledge today. It's been a pleasure having you on the podcast, Dr. Gold.
Thank you so much. Have a great day.
Thank you. You too.
Bye.
Bye. Thanks for listening, everyone. And don't forget to rate, subscribe, and follow, and leave us a 5-star review. Until next time, have a wonderful day.